11:45 a.m. I have 5 hospitals to round at today. I already rounded at 1 out. It's about 45 minutes away. I'm in Rockwall, Texas now, which is pretty far from the other locations. But we do have a case that starts here in the next 30 minutes at 7 a.m. Yeah, I'm on call this weekend. I had a case yesterday. Today is Sunday. We had a case Saturday morning. I had to round at 3 hospitals. And then a case today. Today is Sunday. I'm like losing track of days. And we have a case here in Rockwall, and I have 4 other hospitals to round at in the city. As a fellow, you're the person on call. So anything that comes into the ER or phone calls from patients over the weekend, I had to take all these phone calls all throughout the night. But it's a lot of fun. It's been busy. Yeah, about to be a busy day today, Sunday, and then tomorrow's Monday and a regular work week. So I am here in the doctor's lounge here at the second hospital I have to go to today. Really nice doctor's lounge. They actually have a chef that comes in here and cooks for the doctors, which is incredible. Usually a buffet for lunch and breakfast, and they have all these freaking snacks here. Looks like a freaking grocery store. Chips, different cookies, and I love Snickers. Crazy. It definitely makes up for all the hours that we work and crazy hours that we have coming to a doctor's lounge like this. So I just got to the holding area where we meet the patient before surgery and just answer any remaining questions. We go over the risks, benefits, alternatives to the procedure. Today's surgery consists of an anterior cervical surgery where we'll do a fusion of this patient's neck due to some spinal cord compression. We'll relieve that pressure off of the spinal cord and put a plate and some screws in the neck here. We go through these muscle planes and enter the spine through the front of the neck. Pretty cool procedure. It's actually one of my favorite procedures in spine surgery. We're gonna get started here. After this case, I have to head to those other hospitals to see probably an additional 10 or 11 patients that are in the hospital that we're just following, that are on our service as a spine surgeon. So, see you soon. So we just finished the case. It's about 11:30 a.m. The case went well. We decompressed her spinal cord from the compression of the disc herniation, and we put a plate and some screws to stabilize her spine. We went to the front of the neck here. Had a little bit of problems with bleeding, but overall the case went well. Now I have to head to my next hospitals that I have to round at. The next one's about 30 minutes away. And then there are 2 other ones that are about 20 minutes from there. So, the day continues. Life of a spine surgeon. All right, so it's around 11:45 a.m. Just finished our case, about to head to one of 3 hospitals to round. I have a patient that I need to see at one hospital, and then there are like 6 or 7 at another, and then 2 at another hospital. So heading there next. just leaving hospital number 3, heading to hospital number 4. A lot of patients to see at that hospital, and hopefully we'll be there less than an hour or so and head to the 5th and final hospital of the day. Here we go. So just got to hospital number 4, about to walk in. I have a number of patients to see. I think some patients are getting discharged, so I have to write some orders and some notes so that the nurses can send them home. And then the next hospital, luckily, is like right next door. So it's about a 2 or 3 minute drive right down the street. So that one's pretty close, and that'll be my last one for the day. All right, so 4th hospital was a success. Saw like 7 patients, wrote some notes, discharged 5 of those patients, which means basically writing some orders, writing their prescriptions for pain and muscle relaxants and things like that. Heading to my 5th and final hospital, and then heading to the house to get some rest. I'm exhausted. Every weekend is not like this. It's sporadic, and you may have a case that comes in that needs to be done, surgery, but some weekends are more chill than others. I think because of the holidays, a lot of people are trying to get surgery to meet their deductibles, so of course we get busy, but it is not too bad. It's manageable, but quite busy. Finished rounding at my 5th and final hospital, and now it is around 3 p.m. I'm about to head home, get some rest, and prepare for cases tomorrow. But I want to thank you guys for following along with me today. Like I said, this is not a typical day, but it gives you a sense of what it's like to be a spine surgeon here in the Texas area, where it's a lot of patients and a lot of surgeons here. So during my fellowship year, it's a great but busy year. Thank you guys for following along today. Make sure you subscribe. New videos coming every week. We'll see you next time. Day in the life of a spine surgeon.